What are treatment options for rare pediatric brain tumors? When it comes to rare brain tumors in children, the treatment journey can be quite complex. Doctors usually start with surgery if the tumor is in a location that allows safe removal. The goal is to take out as much of the tumor as possible without harming vital parts of the brain. For some tumors, especially those in accessible areas, surgery can be quite effective and may even be curative. If the tumor causes fluid buildup in the brain, known as hydrocephalus, a surgeon might insert a shunt to drain excess fluid and relieving pressure. After surgery, radiation therapy is often used, especially if the tumor is aggressive or if complete removal wasn't possible. A newer form called proton beam therapy is gaining popularity because it targets tumors more precisely, reducing damage to healthy brain tissue. This is especially important in children because traditional radiation can affect brain development and cause long-term side effects. However, doctors tend to avoid radiation in very young children under age 3 because of these risks. Chemotherapy can also play a role, either alongside radiation or as an alternative when radiation isn't suitable. It helps to target any remaining microscopic tumor cells after surgery. The effectiveness of chemotherapy depends on the specific tumor type, and treatment protocols are continually evolving as scientists learn more about tumor biology. In recent years, advances in understanding the genetic makeup of tumors have led to targeted therapies. These are drugs designed to attack specific genetic mutations found in some tumors. For example, BRAF and MEK inhibitors are being used for certain low-grade gliomas. Researchers are also exploring other targeted options like FGFR inhibitors and tyrosine kinase inhibitors through clinical trials. For very aggressive and hard-to-treat tumors like diffuse intrinsic pontine glioma or DIPG, options are more limited. Surgery isn't usually possible due to the tumor's location in the brainstem. Radiation can temporarily improve symptoms and extend survival, but there is no current cure. Early-stage trials are testing innovative approaches such as delivering drugs directly into the tumor through convection-enhanced delivery and exploring immunotherapies like CAR T-cell therapy. Sometimes, if the tumor is slow-growing and not causing significant symptoms, doctors might recommend careful observation with regular imaging to monitor its progress before starting more aggressive treatments. Because these tumors are rare and complex, treatment is best managed by specialized pediatric neuro-oncology teams at comprehensive cancer centers. Participating in clinical trials is often encouraged, as it provides access to the latest therapies and helps advance research. In summary, treating rare pediatric brain tumors involves a personalized approach that combines surgery, radiation, chemotherapy, and emerging targeted or experimental therapies. The choice depends on the tumor type, location, genetic features, and the child's overall health. Ongoing research continues to seek better options, especially for tumors like DIPG, where current treatments are limited. Families should work closely with experienced medical teams to explore all available options and ensure the best possible care. Always remember, consulting healthcare professionals is essential to tailor treatment plans to each child's unique situation.